Hi, Dr. Jones. This is Anne-Marie Bell, doing my LASA for Comprehensive Health Assessment, Nursing 402. Unfortunately, Dr. Jones, I do not have somebody to participate and help me with this video. I am living in hiding. I had to leave my job, so I could not be followed home. And I am afraid I don't have anybody I can trust to tell where I live. I am sorry about that, and I'm sorry that my grade is going to be bad, but I had to decide whether I wanted to live or I wanted a good grade. My dummy here is Mrs. D, and she's a 25-year-old female who fell over her handlebar on her bike the night before, and so I'm going to be doing a musculoskeletal assessment on her. Knock, knock. Can I come in? Thank you for inviting me in. Hi, Mrs. D. My name is Anne-Marie Bell. I am a nurse here at this facility, and I am in here to do an assessment on you. I'm going to wash my hands. I'm going to sanitize my hands, and then I'm going to ask you your name, okay? Thanks. Do you mind telling me your name, please? Okay. Can I check your bracelet? Okay. Okay, and what's your date of birth? Okay, great. Thank you, Mrs. T. Are you in any pain right now as you lay there? You're having a little bit of pain on movement? Okay. Well, I'm going to do an assessment. I'm going to ask you a little bit more about your pain, a little bit about your history, and then we're going to move on from there. Is that okay with you? Are you comfortable? Okay, great. All right. I have my chart here with me. I'm just going to go down it and ask you a few things. Okay. What date of the week is this, Miss G? Okay, yes, it's Sunday, December 18th. Thank you very much for telling me that. Okay, I've already done a set of vital signs on you. Your vital signs are great, and I have them written down here. So I'm going to start off by asking you, when was your last menstrual period? Okay, a week ago. Okay, that's great. Miss G, your medical history, have you had any surgeries? How about any like diabetes, high blood pressure, any strokes, any heart disease? No? No to all of that? No. What about drinking? Do you drink any alcohol? A little bit of wine once a week? Okay. And do you smoke, Miss G? Do you use any drugs, any illegal drugs? No illegal drugs. Okay. What about your family history? Anybody in your family with diabetes, high blood pressure, heart disease, any cancers? Nothing like that. And I know you said you're not able to move around very well, but if and when you do go home, how is the living situation? Do you have throw rugs? No throw rugs? Everything's open? You'll be able to ambulate with a walker if need be? Okay. Thank you, Miss G. Well, now that we've talked, and I'm going to just go ahead and start my assessment. Okay, I'm going to put my papers right down here. I have your vital signs on it. And while I talk and do your assessment, I'll be asking questions. I'm going to ask you about your pain on a scale of 0 to 10. 0 being no pain, 10 being the worst pain imaginable. So when you have pain, tell me what your pain scale is. And the type of pain you're having. Is it sharp? Is it dull? Is it throbbing? Okay. Okay, Ms. G. So first I'm going to start with a neurovascular assessment. And I'm just going to check your cranial nerves. And I'm going to check your cranial nerves number 2 and 3. And I just want you to open your eyes. This is my pen light. Just want you to look straight at me. I'm just going to check your pupils, okay? Okay, good. The other pupil, I separate, blocked it off with my hand. Okay, good. Now, Miss G, I would like you to just close your eyes really tight. Very tight, okay? Open them wide. Lift your brows. Okay, you're lifting your brows. Okay, I just want you to follow this pen. Okay, just follow it just with your eyes. Don't move your head. Okay? Follow the pen. Okay? Okay, now towards me. Okay. I just checked 6 points of eye movements right there, Miss G. Checking your ocular motor nerve, cranial nerve number 3 and 4, your trochlear nerve, and I just want to check your trigeminal nerve, cranial nerve number 5. Can you just open your mouth? Move your jaw around? Okay. That's very good, Miss G. Now your facial nerve, this is a little piece of cotton, and I'm just going to touch you. You tell me every time you feel me touch. I'm touch your face, your cheek. Okay, good. Other cheek. Okay. Forehead. You felt? Chin. Okay. So you felt that. So I was able to do your eyebrows. Now, Miss G, I just want you to swallow. I just want to see your throat move as you swallow. Just swallow. Okay, very good, Miss G. And move your shoulders a little bit. I know the right shoulder hurts. Okay, and just move your head side to side. Miss G, have you had any vomiting? Vomiting without being nauseous, just projectile? No vomiting at all? No vomiting. Did you lose consciousness when you fell? No, you did not. Okay. Well, I know you have a bruise on your thigh, your right thigh, and I'll measure that and take a look at it during this examination. Will that be okay with you? Okay. Now let me see your tongue, Miss G. Stick your tongue out. Wide, tongue out and in. Okay. Thank you very much. Do you have any headaches, weakness, any tingling? Now hold my hand and squeeze. Okay. Okay. Motor strength is very good on your left side, Miss G. On the right side is a little weak. I can understand your wrist hurts and your right shoulder hurts, so I understand that. I'm just going to go down to your legs and touch the bottom of your foot. I'm going to push your foot and just want you to press back, push back on me. Okay. And it's the same thing here. It's normal on the right side, Miss G, but it's a little weak on the left side, which we expect with the pain that you're having. Okay. Have you fallen before? Any falls, any trauma, any accident, anything like that? Nothing like that. And no projectile vomiting, you said. Did you have any chest pain or any palpitations before, during, or after the fall? No chest pain, no palpitations, your heartbeat's not skipping? Okay. Okay, Miss G. So, I am going to start with what's called range of motion, a little passive range of motion, a little active. Active range of motion, you moving the extremity for me. Passive, I'm going to help you. Now, we won't go past the point of pain. You tell me if I hurt you. First, now, can you hold my hands and squeeze them? Okay, you're very strong. Okay, on the left. Right side is not so strong as the left. Any numbness, tingling? I'm going to look at your hand. I'm going to take your hand. Your right hand of the right fingers of the right hand, and move your fingers. Okay, I'm going to push my hand here, push down, down, down. Okay, still have some strength in it. This one too. Yeah, much stronger on that side. And move your fingers around. Let me see your fingers move. Close, open your fist, close them. Okay, do you have any pain in the elbow? Okay, no pain in your elbow. I won't move your elbow because your wrist and your shoulder hurt so much, and I won't do that. Okay. So you say your pain is a 3 when you're just laying there and an 8 when you move anything? Okay, Miss G, I will take care of that. I'm just going to go ahead and check your pulses. Your radial pulse, I'm going to check both. And then I'm going to go down to your legs and I'm going to touch your pedal pulse, both. And then I'm going to go ahead, Miss G, and I'm going to check your post-tibial pulses. Just to make sure everything's okay. Everything is fine. No tingling, numbness. I know your extremity is nice and warm. Okay. No pallor. They're not pale or anything like that. Okay, we check the radial and pedal pulses. No paralysis except you have pain on movement. No tingling, numbness, numbing sensation in the fingers. Okay. Okay, Miss G, I am just going to check your shoulder, your right shoulder. I know you can't move it. I'm just going to feel behind the scapula. I'm going to check for what they call winged, if it's protruded outwards. I'm just going to push my hand right back here. I'll help you. Are you nice and warm? Okay, you're warm. Thank you. Okay, that's fine. It feels normal. So there's nothing back there like anything's wrong with the scapula. And it's nice and warm, then you have all your distal pulses. Okay. Okay. Let me see your fingers again, Miss G. I'm just going to check your medial nerve, radial nerve, and your ulnar nerves. I just want you to touch your fingers. Each finger touch your thumb. Each finger to the thumb. Okay, that worked very well. And now push my hand away. Okay, very good. And now open your fingers. Okay, Miss G, thank you very much. Now I'm going to have you flex your elbow for me without moving your shoulder too much. Let's see. I want to assess your elbow, make sure your elbow is okay. Okay. All right, and you do get some pain. Okay, Miss G, you can stop right there. Okay. I'm going to go down to your leg. I know you have a problem weight bearing on the right side, so I won't do anything. Any pain in the knee? No pain in the knee? Okay, I'm just checking your knee. All right. And I won't let you move your hip. Okay, and I'm just going to go down and check your ankle. Now, can you dorsiflex your foot? Can you push down and raise your toes and push them down and raise them? Okay. Actually pretty good. They actually equal your ankles on this side. Okay, the collar, there's no swelling. And I check the knee. Okay. Miss G, there's no shortening of your right hip. So I don't see any deformity right now in that side of you. Do you have any questions for me? No questions? Well, thank you very much. And I will talk to the doctor and I'll come back and see you in a few minutes. Are you warm enough? Thank you. At this point in the exam, Miss G is resting, and I will ask the doctor if she could get something a little stronger for pain, as the Tylenol she took last night did not help her very much. At this point, maybe the doctor will recommend some lab works to be drawn. He may want a CBC, check her RBCs and white blood cells and all that stuff. Maybe he may want a CK, a creatinine kinase, to check if which gets elevated during muscle damage. He may sometimes want to check ESR, SED rate, and also maybe some electrolytes. Make sure her electrolytes are not off. At this point too, he may want to order x-ray, especially of the hip, the right hip and thigh and the right wrist, to make sure that there's no fractures. I did not do too much range of motion on the right side, as if there are fractures there, and I don't want to make anything worse, because sometimes the fracture is reduced, which means the ends are together, and I don't want to do any damage if they are. So the labs may be an MRI and some x-rays on the right side of Miss G. Thank you and have a nice day.